Hello everyone, welcome back to another video. My name is Saurabh. Today video topic is about sulfonamide tragedy and FDAC Act. The elixir sulfonamide disaster was a mass poisoning in the United States in 1937. It caused the death of more than 100 people. The public outcry caused by this incident and other similar disasters led to the passing of the 1938 Federal Food, Drug and Cosmetic Act. In 1937, S.C. Massielli, a pharmaceutical manufacturer, created a preparation of sulfonamide using diethyl glycol as a solvent and called the preparation elixir sulfonamide. Diethylene glycol is poisonous to humans, but Harold Watkins, the company's chief pharmacist and chemist, was not aware of this. The company chemist merely added raspberry flavoring to the sulfa drug which he had discovered dissolved in DEG, and the company marked the product. Although animal testing should be have been routine in the most drug company operations, Massingle performed none and there were no regulations requiring pre-market safety testing of new drugs. The company started selling and distributing the medications in September 1937. By 11th of October, the American Medical Association received a report of several deaths caused by the medication. The Food and Drug Administration was notified and extensive research was conducted to recover and distributed medicine. Frances Oldham Kelsey assisted on the research of project which verified that the excipient diethylene glycol was responsible for the fatal adverse effect. At least 100 deaths were blamed on the medication. The owner of the company, when pressed to admit some major culpability, famously answered, "We have been supplying a legitimate professional demand and not once could have foreseen the unlooked for the results. I do not feel that there was any responsibility on our part." Messenger's chief chemist Arnold Watkins committed suicide while awaiting trial. The Federal Food, Drug and Cosmetic Act 1938 was direct result of this tragedy by replacing the Pure Food and Drug Act in 1906 and giving the FDA considerably more powers and authority. This act would be amended in 1976 to include regulations for medical devices. This is where we find the section 510 for the 90-day notification of intention to market a medical device. The different classes that devices are approved under the details the pre-market approval process. The FDA has its beginnings with both outrageous claims and medical tragedy. This history is important to keep in mind when thinking of FDA's mandate for safety and efficacy of all medical devices, including vitro diagnostics. Thank you.